Hello, my name is Caroline Mendoza, and today I will be presenting how occupational therapy is actively shaping my future. When discussing my path to OT, I will be describing how one, doing relates to occupational therapy, two, how being encompasses the heart of OT, and three, how I will become the practitioner of my aspired profession. As an occupational therapist, we ask what matters to you, not what's the matter with you. Important words stated by former president of the American Occupational Therapy Association, Virginia Jenny Stoffel, which hones into the vital mindset of any OT practitioner by differentiating between just assisting the patient to being able to connect and understand what their needs are. In my first section, I will be discussing what I am doing in order to make being an OT a reality. As I study the qualities of an OT practitioner, I am actively building relationships with people on a more interpersonal level. I have been shadowing at two sites where I essentially put myself in the headspace of these patients in order to fully grasp what they are going through and what their needs are. The residents in the older adult care facility that I have made these relationships with feel as if whenever they are working with the OT, they're actually being listened to instead of just being attended to. In an article titled Experimental Learning in Occupational Therapy Can It Enhance Readiness for Clinical Practice? I read how these aspects of OT can help any area of medical practice. In the study, it focused on how adjusting procedures of these medical students to match those of an OT practitioner can increase understanding of the patient, needs, and improve clinical reasoning skills and professional qualities needed for an effective clinician. This is important to me because it shows just how much others can learn from the profession and adopt these qualities in order to better assist the patient in need. Now I will be discussing how OT was introduced to me and why I am suited for the job. Prior to discovering OT, I had realized that I was on the path that wasn't meant for me. I knew that I wanted to work in the medical field, but the profession I was pursuing previously was just not fulfilling enough. I love to talk to people and socialize, essentially getting to know them. I realized with being compassionate and wanting to build these relationships with other people, I wanted to help and I needed a more meaningful profession that would require these qualities. I was introduced to OT through an advisor at Dominican and fell in love. From there on out, I did everything that I could to learn more about OT, job shadowing, researching, and speaking to other OTs currently in the field. In my final section of becoming, I further delved into the research of OT and the many fields that I can go into and practice in. At the beginning of my search, I knew that I wanted to work with the adult or older adult population. I wanted to be able to talk to them and understand their needs and perhaps even being able to relate or empathize with them. More specifically, the older adults that I have been working with made me realize that they have lost the liveliness in their occupations and that I can one day bring that back to them. In an article titled Senior Dance as a Resource of Occupational Therapists with Older Adults Contributions in the Quality of Life, it focuses on how dance can be utilized as a resource to OTs to overall improve the quality of life through a hobby most don't even participate in or would even care to at this age. The positive correlation between dancing as an occupation and the overall improvement of well being were statistically significant, and it was noted that the patients were happy it was introduced to them and provided more of a stimulating form of leisure. As I learn more about assisting older adult populations, I would like to do more research on these methods of rehabilitation to better expand my resources as an OT practitioner instead of sticking to the traditional methods. Similarly, in an article titled Creating Environments Through the Art of Occupational Therapy, it looked at how the setting of the environment of the patient resides in can affect their overall well being. Using therapeutic settings, specifically gardens, as a form of therapy, it was found that it can enhance well being, limit hospital check ins, and decrease stress and anxiety in older adults being studied. This is another method seen as non traditional. However, we can learn much from it and even start making it a norm for care facilities to have an environment in which patients can actively engage or just relax in nature. As I further investigate how the older adult population can be better assisted, methods like these are aspects of OT that I would like to contribute to by making older adult care facilities promote well being through external means, like the gardens mentioned. My journey to becoming an occupational therapist is one that is ongoing, but will ultimately be reached with learning and acquiring all of these skills. It's important to understand that with such a profession, I will always be learning and finding new and innovative ways to assist others in their desired occupation through unique treatment best suited for them. Thank you.